It's a little frustrating, so I'm going to make things really easy. You just had surgery with me, and you're getting some antibiotics, you're getting some pain medication, you're getting some steroids, some anti-nausea medication also, and some ointment probably to put on your wounds. So I'm making this video because this way at your own leisure when you're home, if you're not sure, you can play it back and forth as many times as you want, which will give you a drug dosing. So we're giving you an antibiotic. The antibiotic will probably be either Duracef or Zithromax. If it's Duracef, you take 1 tablet twice a day for 10 days. Your first dose of your Duracef will probably be falling in about 3 o'clock in the afternoon, since we gave it to you the very first part of the morning. So you'll take your first Duracef at like 4 o'clock in the afternoon. Then you'll take, that's the end of day 1, antibiotics. Then you'll take your Duracef 7 a.m., 7 p.m., 7 a.m., 7 p.m., or if you prefer, 8 a.m., 8 p.m., 8 a.m., 8 p.m., and finish those 10 days worth of the antibiotics. The second drug on the list is something called a Medrol dose pack. The Medrol dose pack kind of looks like what the women used to take for birth control. It's a tapered dose. You take X number of pills on day 1, a little less on day 2, a little less on day 3. So typically, we're going to give you steroids in the operating room, which will be taking care of the morning and the lunchtime dose of the Decadron, or excuse me, the prednisone. So you'll take your first steroid at about dinner time, 5 or 6 o'clock at night, and then 2 before you go to bed. And the next day, you'll take 1 at breakfast, 1 at lunch, 1 at dinner, and 2 before you go to bed, and there'll be a tapered dose. And you're going to receive something called Odontostrome or Zofran. Zofran is a drug that we give because sometimes you get a little nauseated from some of the Percocet we give you or some of the narcotics we give you. And basically, it's a great drug. You'll take 1 of those tablets, you put it under your tongue every 4 to 6 hours to help decrease any nausea that you may have. What everybody will usually get is something called Percocet. Percocet is a pain medication. And what we recommend people to do is to buy a pill cutter, cut 3 tablets into quarter pieces, and when you have your first time of discomfort, you take a quarter of a tablet. You wait 20 minutes. If you're still uncomfortable, then you take another quarter of a tablet. Wait 20 minutes, and then you take another quarter of a tablet. The whole concept is that you taking a quarter of a tablet, allowing that medication to set up and work, so you don't take a lot of Percocet for 2 reasons. 1, we don't want you getting addicted to the narcotic. And number 2, there are some very bad side effects of Percocet, including getting nauseated, where you have to throw up. 2, you're getting constipated. And nobody wants that to happen. So if you're eating, you have a lot of Percocet on board, you'll eat your food, you'll get an upset stomach, and you may throw up. So who wants that? So my conversation for you is take as little Percocet as you need to feel better. A lot of young women who I've done breast augmentations on over the years have disregarded what I have told them, and they pop the Percocets like candy. They'll take 2 Percocets every 3 to 4 hours, and I will hear from them 2 to 3 days after surgery, and they're complaining that they're nauseated, they have an upset stomach, and they're puking. Never do I hear that their breasts are uncomfortable or they have some stiffness or tightness in the chest. It's usually from the fact that they're taking too much Percocet. So I want you to take as little Percocet as you need. The drug that will probably be given to people that have tummy tucks and or breast augmentation is something called Scalaxin or Flexeril. These are muscle relaxants, and they do exactly what they say. You take 1 of those tablets every 4 to 6 hours as you need, because it's going to take the stress off the muscle and kind of relax it and put it to sleep. And I find a lot of the women, if they take the Flexeril, they'll feel a lot less pain from their breast augmentation. Is we give you an ointment. If we're doing eyelid surgery, you're probably going to get a bacitracin ophthalmic a polysporin ophthalmic or an erythromycin ophthalmic ointment. And the tube is really little. Basically, you just got to put a tiny little bit on your fingertip and wipe it along the upper eyelid incisions, usually over the steri strip that's covering the incisions, and on your lower eyelids. You probably need to do that no more than 3 times a day. You don't drench the incisions, just lightly coating them so they glisten. Now, if we've done a rhinoplasty or some breast surgery or liposuction better, you'll have little incisions that need to have a little tender love and care. And for those incisions, the one here at the bottom of your nose, the liposuction on your flanks or on the lower portion of your belly or your elbows, you basically take a little bacitracin on your finger, you put it underneath your bottom of your nostril right over here, you put a little bit on the elbow incision, a little bit on the flank incision, and the abdominal incisions or in between the legs if we've done liposuction. You'll do that once or twice a day, and everywhere but the nose, you'll just put a Band-Aid over that. That's the whole dressing care that you really need to do for the liposuction. But for the most part, I'm sure I've left some things out of the drugs I give out, but this little video will hopefully help elucidate some of these recommendations so that you don't panic, that you don't know what to do with your drugs. Even though you have a printout of the pictures of all the drugs, you have it written with a piece of paper that you've gone home with the packet. I've gone over it with you. The nurses have gone it over with you and your caretaker. So hopefully this will make you feel a little more comfortable and don't get so concerned about how often and what antibiotics and or medications you need to take. You can play this tape back as many times as you like. I hope it's been informative and you will heal up nicely. Just, it's hard to have patience when you're the patient. Have a wonderful evening and take care.